Uh, All right. Good morning, good afternoon, good evening, depending on where and when you are watching this Facebook Live. This is the voice and the face of Dr. Tola Labinton, CEO, founder of Living Spring Family Medical Center here in the good city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. I'm very excited today to have my friend and doctor, Dr. Rebecca Berens, and we'll be discussing the topic, Doc, someone I love has an eating disorder. Help me help them. Thank you, Dr. Behrens, for coming. I'm honored to have you on.
Thank you so much for having me. I'm so happy to be here.
All right, awesome, awesome. Now, I've already mentioned your name, but for those who are watching live, for those of you watching live, hashtag live, and those in replay, hashtag replay, who are you and what do you do?
Yeah, so I'm a family physician and I'm also a lactation consultant, and I have a private practice in Houston, Texas. And so I provide primary care services to individuals and families of all ages, as well as lactation consults to new parents of families who are struggling with breastfeeding.
Awesome. So you dabble in a lot of things. So love what you do, by the way. Um, and now my next question is, why do you do what you do, Doc? What prompted? Yeah.
Yeah, so I follow a health at every size approach with my patients for primary care. And I do that because I actually had an eating disorder when I was in college. And so I really understand the frustration and the stress of going to the doctor when you've been through something like that, because there are a lot of physicians and other healthcare professionals who have some well-intentioned but harmful advice or comments that they make to people who are in that situation. And I understand that. I've been through that myself. So I try to take a health at every size approach with my patients. I have several patients who have a history of an eating disorder or in recovery. And as part of their ongoing health care, they need a primary care physician who understands that and is able to support them through that as well.
Awesome, awesome. So you can relate to what many of patients with eating disorders are going through, and so that's why you decided to do this. Very, very good, very good. Now, for definition's sake, what are eating disorders? What does that mean?
So there are various categories of eating disorders, but in general, eating disorders are both behavioral, psychological, and biological conditions in which the individual has certain behaviors around eating, whether that's restriction, binging, or purging, or some combination of all of those things. And so there are various subtypes of eating disorders. Anorexia and bulimia are the most commonly known types. There's also binge eating disorder and ARFID, which is like avoidant restrictive feeding disorder. And so the commonality among them is that there are psychological preoccupations around food and eating, and there are behavioral changes around food and eating, whether that's restricting caloric intake, certain types of foods, and or trying to purge certain types of foods, whether that's by vomiting, laxative, or compensatory behaviors like overexercising to compensate for intake of food. And so that's sort of like a general overview of the different types of eating disorders, without getting too much into the specifics.
Okay. If I were to, dig a little bit, so how would you? Because someone may be watching and say, "Wait, I am careful about what I eat. I do count my calories. I do exercise. When does it kind of, move into a disorder category versus me being more judicious or more cautious about what I put into my body?"
Yeah, so it can be a slippery slope. A lot of people who have eating disorders, that's how it started. They started just trying to be more health conscious, and it can become a slippery slope when you get into a negative energy balance. The way that you think about or perceive food can start to become more disordered. I would say the times when it becomes more disordered is when it becomes a very inflexible behavior where it starts to impact your life. You're not able to go out to eat with friends, go to a party and eat the food that's available, go to someone's house for dinner and eat the food that they serve you, because of this like very inflexible restriction. Or if it starts to come to a point where you're purging the food, as a result of your concern about the intake. But it is a slippery slope, and that's part of why I encourage patients to have a more holistic view of what they're eating and how their health behaviors, rather than becoming unnecessarily restrictive or inflexible.
Awesome. Very, very important points. When it's starting to affect your quality of life, your ability to interact normally in a diet or food availability situation, that could be a warning sign. Now, for someone who's watching who's saying, well, purging, doc, what's the big deal? I ate something I shouldn't eat, and I want to get rid of it so it doesn't harm my body. Why is that a problem?
Yeah, so purging can be extremely dangerous. When you force yourself to purge, whether that's by inducing vomiting, using laxatives, using diuretics, people who are diabetic sometimes will do this by withholding insulin. That causes a lot of electrolyte disturbances in your body. You can lose important electrolytes. You can become extremely dehydrated. And in ongoing restriction and binge purging situations, it can result in very dangerous electrolyte imbalances that can cause heart arrhythmias and can be fatal. So that is very, very dangerous. And I always tell someone, if you ate something that you shouldn't eat, first of all, who says you shouldn't eat it? It's food. Unless it's toxically harmful to you and you had like activated charcoal given to you in the ER, there's no reason that you need to purge something from your body. Food is not toxic. So, if it's not fitting into your overall health plan, you can make different choices in the future, but it's not something that needs to be purged from your body. It's not toxic. It's food. Food is not toxic.
Awesome. Thank you so much for answering that question. And I wanted to highlight, when she says arrhythmias, it means abnormal heart beats. It can actually cause electrolyte imbalances. Sodium, potassium, calcium can become abnormally low or too high because of that, of the purging, and affect how your heart beats. And that could be deadly. So very, very important to note. Thank you, Doc. I think you touched on this already before, but I wanted to ask, for those who who are watching and saying, what, I think a family member or someone I love has this. What are warning signs and symptoms that one should look out for when it comes to eating disorders?
Yeah, so a lot of what you will notice is behavioral changes. So becoming excessively restrictive or inflexible about food. Saying like maybe someone who suddenly switches from a normal American diet to a very restrictive type of diet, and they're very inflexible with that. Or saying, I'm no longer eating carbs, I'm no longer eating fat, and being very inflexible with that. Someone who is unnecessarily or excessively preoccupied about their body shape or size or weight, to the point that, again, it's impacting their ability to be flexible in day-to-day life and get through normal activities, normal social activities, family activities. Often there are weight fluctuations. So whether that's weight loss or weight gain, even in some cases, depending on the type of eating disorder, but there are not always weight fluctuations. It's really more of the behavioral and the attitude towards it that becomes increasingly restrictive and inflexible to the point that it's becoming difficult for that person to function in social normal situations.
Wow. Thank you. Very good to know. So just you start to see a restrictive, almost like an absolute no gray zone. Like they're very, very, very restrictive. Now, I was going to ask you, Doc, are certain people more at risk than others?
Yes, so there are certainly several biological and social and psychological factors that can predispose someone to an eating disorder. So they are genetic. If you have a close family member with an eating disorder, that does increase your risk. There is a genetic component to that. It is more common in people who have another type of mood disorder, such as depression or anxiety. It can be a more common occurrence in people who already suffer from those. And then certain personality types, people who are maybe more perfectionistic, more inflexible in general in their personality, are going to be at an increased risk. And then certainly social impact on that person. So you can have all of these predispositions, but just because you have maybe anxiety and are perfectionistic and have a family member with an eating disorder doesn't mean you're going to get one, but social factors can influence and bring that to the surface. So certain sports that are more heavily focused on the physique or looking a certain way, track and field, ballet, a lot of these things that have a very physical component to them that often coaches or other competitors will comment on can increase the risk. The general societal focus on thinness as an ideal can be very, can give some harmful messaging to people who are at risk already, and can make that more of a preoccupation. And then going through changes in life. So often during puberty, when the body is changing and the person has changed, their body shape and size has changed rapidly over a short course of time in a way that feels out of control, that is a really common time for an eating disorder to develop. People who are transgender, non-binary, LGBTQ, often there are different body image and ideals that are associated with those concerns that can predispose someone as well. So there's a lot of different factors. It's never just one thing. And at the end of the day, it's rarely actually about food. It's usually a combination of these psychological, biological, and social factors that are influencing that person to develop the eating disorder.
Thank you for highlighting that. And I like that you mentioned that just because one is of this type, like type A personality, doesn't mean you will. These are things that may tend to be associated with or at risk, a risk factor for those, or a potential cause, or so it's not absolute. It's not a direct correlation. Is what I'm trying to say.
Yeah,
Okay,
yeah.
you will. It means there's a possibility. Now, for someone who's watching this, who's saying, yes, I get this. I understand the dangers in eating disorder. And by the way, these are medical suggestions. It's very, 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 very important for you to see your doctor, see your caregiver, to discuss a plan that's individual for you or unique to you. But what would you just say to that person who's saying, you know what, I understand that I need to have this addressed for my loved one. What are first steps? What would you say, Doc?
Yeah, so I think it's very important if you have a loved one who you're concerned about, it's very important to take it seriously, and definitely try to help that person, because eating disorders are some of the most deadly psychiatric disorders, second only to opioid use disorder. So they are deadly. They are very serious. And the earlier that a person is able to get treatment and get into recovery, the more likely that they will have a sustained recovery throughout their lifetime. It's very common if treatment is delayed that the person can have multiple relapses, and it's very hard to treat the longer it's been going on. So definitely, if you notice signs of this, it's important to help that person early. I recommend trying to gently bring it up with that person, understanding that the person may feel often people with eating disorders do not believe that they have a problem, and you may receive a hostile reaction. So being able to privately and gently and respectfully talk with that person, use I statements, talk about like, I'm concerned about this that I see in you, stick to the facts. Try not to give them some of the less helpful things that I hear people say is like, well, just eat it. It's not a big deal. To that person, it's a very big deal. And it's oversimplifying it does not help the situation. So, gently approaching them, using I statements, sticking to the facts, offering to help support them in seeking help. And if they're looking for help, they should start with their physician, and ideally also a therapist who has some specialization in eating disorder treatment, and a dietitian who has specialization and training in the treatment of eating disorders. That team approach is really important because, again, this is a medical issue. It's a biological issue. Nutrition is an extremely important part of treatment and should be addressed by someone who understands eating disorders. And there's obviously the psychological component that a therapist needs to be involved with for treatment. So it's really important to have that team approach and helping to support that person and reaching out for help, because it is hard. it's hard to ask for help. But showing that you're going to be there, following up with them to ask like, hey, were you ever able to get that appointment? Is there anything I can do to help you? Do you want me to come with you? Would that be helpful to be a support to you at that appointment? I think that's all things that that could be really helpful if you meet someone who's going through that.
Thank you so much, Doc. I'm taking notes. So that's why I'm looking down. There's something you said that, well, there are many things you said that are very important, but you said it's very important to know that to them, it's a big deal. It may not seem like a big deal when it comes to food to you, but to them it is. And really understanding that is key to reaching them. You mentioned three things when I took as, addressing them respectfully, talking down or making them feel bad. And then you mentioned the I, using the I statement. The I, could you expound on that a little bit, Doc?
Yeah, absolutely. So when you're concerned about a person, if you say like, you're doing this wrong, that increases the stigma that person feels, because eating disorders are extremely stigmatized. So even you bringing up to a person like, I think you may have an eating disorder, that can feel very stigmatizing to that person. So if you focus on like, I have noticed that you are eating much less than you used to. I've noticed that you're no longer eating these foods that you used to enjoy. I've noticed a significant change in your weight in the last few months. You're focusing on facts that you observe. You're not placing blame or, it's not going to feel as an attack on that person. You're just stating facts from your perspective. And no one can argue with your perspective, right? It's like, this is what I am seeing. That feels much less of an attack and much less stigmatizing than if you're saying like, you're doing this wrong. You're doing, you feels an attack.
All right, I get it. Very good. I have noticed. Focus on facts, not on placing blame. All right, we have a question. Hi, Miss Shirley. Hi, Dr. Mitra. Thank you for joining. So he says, good morning. I have a concern for a friend's grandson. He only wants to eat Doritos or Cheetos for breakfast, lunch, and dinner. Hi, Dr. Una. He will occasionally eat pizza or chicken nuggets, but there's never a fruit or veggie in his diet. He throws a tantrum if they try to get him to eat healthier. So to avoid the drama, they give in. He's 13 now and has eaten this way for a few years. What would you say to that individual?
Yeah, and so this can be a common issue amongst kids, especially where they maybe are pickier about certain foods. There may be textural issues about certain foods that they don't tolerate as well. I think it's important to approach this gently and definitely with the support of a dietitian who has worked with kids and adolescents, especially because moving into adolescence, as I said, is a really tricky time and a very triggering time. And so trying to make it a family focus where everyone in the family is eating similarly, bringing different foods into the family for everyone to share and making it a family sort of social situation, but definitely getting help with a dietitian in this situation because we want to make sure that all of their nutritional needs are being met. We're not unnecessarily hyper focusing on certain types of foods because that is going to be resisted against, especially in that early teen where you're developing your resistance and you're learning your own autonomy and how to say no. There's going to be a lot of resistance if it's forced. So you want to make it a family decision and get support for that child.
Awesome. Thank you so much, Doc. I hope that was helpful, Miss Shirley. Now, you already touched on this question before, but I want to ask it in a different way. How do we find help? You had mentioned that it's a team approach to taking care of someone with an eating disorder, therapy, making sure the psychological aspect is taken care of, a nutritionist, seeing your primary care doctor and letting them know that this is a concern. But for someone who's watching, and you said this before, most people with an eating disorder will not seek out help because they don't think there's an issue. So let's say there's someone who's watching and they're able to share this video with someone they care about and are concerned that they have an eating disorder. How can they find help? Let's say virtually, online, like somewhere they can look up, ways to get help.
Yeah, so the National Eating Disorder Association has a website. It's nationaleatingdisorders.org. And they have a screening tool that you can take to go through and it basically screens some of the behaviors if you're concerned to show when you need to seek help. And they also have a helpline that can help to connect you with resources in your local area as well as virtually. I definitely always recommend trying to seek out people who do have additional training in eating disorders. There's a designation CEDS, which is Certified Eating Disorder Specialist. If possible, seeing someone with that certification or who is in the process of getting that certification, who has that additional training, is going to be really, really helpful. But the National Eating Disorders Association has a lot of great resources on their website. So it's nationaleatingdisorders.org.
Awesome. Thank you so much. This has been so helpful. Thank you for those who are watching live and who are watching replay. And thank you for engaging with the chat. I mean, I've learned a lot, and I know this is going to help me help my patients as well as those who are watching this. Now, people are wondering, I like this doc, and she's in Texas too. Where can people connect, and how can people connect with you, doc?
Yeah, so I am on social media, Instagram and TikTok at Rebecca Berens, MD. And my practice is Vida Family Medicine, VIDA, in the Houston Heights. My website is vidafamilydpc.com.
Awesome. And I'll be sure to share that after this live so people know how to reach you. Thank you, thank you, thank you, thank you. It's nice to see you again, by the way.
Thank you for having me. It's so great to see you.
Thanks. All right, that's it. Thank you so much for watching. Please share. It is good to share. Sharing is caring. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician here in the Mansfield area, I am she. Have a good one. Bye.
Bye.